Well, yesterday we told you about a surge in patients at the Children's Hospital of Eastern Ontario. CHEO says a 6-week surge in inpatient medical wards has led to the facility being packed. The hospital says more young people than normal have been showing up sicker than normal. This is due to COVID, flu, surgeries, and many other causes, and comes just weeks after McMaster Children's Hospital in Hamilton also reported record numbers. Now, Dr. Dina is a pediatrician and founder of Kid Crew and joins us live on CP24 Breakfast this morning. Dr. Kulik, thanks for joining us to talk about this. Are you seeing an uptick in children requiring medical care in your practice?
Absolutely, and this is not a new thing. We've seen huge numbers, huge volumes at Kid Crew and at other clinics and hospitals in Toronto and across Ontario for a number of months. Lots of flu-like illness, lots of COVID, of course, and lots of other viruses that we don't even know what they are necessarily, but certainly huge volumes the last few months.
Do you sort of look at this and say, well, when masks came off right around the March break time, is that mostly what you attribute this to, or are there other factors?
Well, it's been high for really about 2 years, COVID and otherwise, but certainly as kids went back to, school and daycare and people went back to work in person without masks, that's a good way to spread things. Masks are protective against COVID and, of course, many other viruses as we're spreading less droplets between one another.
Right. Okay. And so here we are at a time when public health measures are effectively, we've gotten rid of mask mandates on public transit. It sounds like we're getting rid of vaccination and sort of other mandates when it comes to federal travel and everything else. Does any of this surprise you, or was this sort of entirely predictable that we would see this upswing and uptick in demand for healthcare effectively?
I think we all expected to see more viruses, but it's really unprecedented. The numbers we're seeing now in spring season, which is typically lower because we're outdoors and there's less, reason to be on top of one another like we have in the winter when things spread more readily. This is higher than really any winter season we've ever seen before COVID when no one was wearing masks. So it is higher than what we typically see. And it seems to just keep on increasing, honestly, even since the mask mandate was lifted.
Right. Okay. So you're the doctor, Dr. Kulik. What's the remedy here? What's the fix?
I think we need to go back to, the recommendations around public health guidance. We don't necessarily need to be wearing masks, but if your child is sick, if you're sick, please stay home. We want to avoid spreading all of the viruses, not just COVID, but all of the viruses. Of course, COVID testing isn't perfect, so we're not always entirely sure if we have COVID or we don't. If you're sick, please stay home and keep your hands clean, keep distance from people if you're unwell, and that's how we're going to keep people less sick and out of hospitals and out of clinics so that everyone can feel a lot better. And
before we let you go, Dr. Kulik, the one thing the CHEO tweet, that thread that we talked about yesterday mentioned was, even though they are sort of at capacity or above capacity in their ER, nobody is going to be turned away. But do you have any sort of threshold or advice to people when it comes to, you've got a sick child, where you should take them depending on what their symptoms are feeling?
If your child is very unwell, if they're not drinking, they're lethargic, they're having difficulty breathing, they're not able to tolerate any fluids, if you're really worried about them in that way, the emergency room is the best place. But the vast majority of children can be followed virtually or in person by their primary care provider. There's so many walk-in clinics now, virtual options. Those are a good first step before going to the emergency room, unless your child really needs emergency level care.
Okay, Dr. Dina, always appreciate the insight from you. Thanks so much for being here again this morning. Appreciate the time.